To the Rejuvenation and Resilience series. This is our 7th video, and today we are joined by Nikita Burke, who is a PhD in neuroscience from the Hotchkiss Brain Institute, who is one of our very valued wellness partners here at ATB. So hi and welcome, Nikita.
Hi everyone. Hi Tara.
We invited Nikita to come and chat with us today to talk about the neuroscience of yoga and meditation as therapies for stress and pain. And so all of these are things that we're all interested in, and I can't wait to hear how we're going to put them all together. Let's start off and chat about, we have all experienced pain, but can you explain from a neuroscience perspective, what is pain?
So the definition of pain is that it's an unpleasant sensory and emotional experience, but essentially what it is a warning system to alert us to any potential tissue damage or actual tissue damage. But pain is so complex that it's not just this one experience. It's, as I said, it is sensory. So in that way, your body lets you know where is the pain in your body, what is quality, is it like a burning or aching type of pain, and maybe how intense it is on a scale of, for example, 1 to 10. But we also know that pain is very emotional, it's unpleasant, and it's aversive, and it's something that we want to avoid. So we all remember, we might not all remember, but at some point when we were children, we put our hands onto a hot stove, and we learned very quickly to remove our hands. That's a reflex, but also we remembered that that's not nice and that we would avoid it in the future.
Yes, I specifically remember very clearly. It's right there.
Yes.
When I was very young, I was not tall enough to see the stove, and then put my hand up on the stove, and yeah, I still have that mark, and I showed my kids the other day after you and I had this chat.
Very good. So yeah, so exactly. So there's a memory component of it as well. So your brain remembers pain. That also will influence how you experience it the next time. So if you've had a bad experience at the dentist, the next time you go, your memory of that might actually make the pain worse because of the anticipation effects. Pain is also associated with anxiety, which we'll talk about a little bit later. But why do we have pain? Well, essentially it is protective. It is there for our survival. Acute pain, like a toothache or a broken bone or a burn or something like that, is limited, and the pain will go away when healing occurs, which is great. It also responds very well to treatment. So some of the medications that we use for treating acute pain might include aspirin or acetaminophen or ibuprofen, and these work very well for acute pain. We also use things like opioids, like morphine, for example, if you're in an accident and emergency situation. The medications actually work very well for acute pain.
Okay, well, hopefully we don't have to get in that situation too often, but yes, I'm sure we're all familiar with the over-the-counter pain medications. So when we experience pain, what is happening in our brain?
Okay, so it's really, really interesting actually what happens. It's a really complex and coordinated response. So pain occurs basically starting off, a painful or a potentially damaging stimulus will activate specific pain receptors in our body. And these neurons or nerve fibers that are also specific for pain will carry this into the spinal cord. And pain here is integrated, the pain signal, and it is then sent up to the brain. But it's only when it reaches the brain is when it becomes pain. That's when pain is actually perceived. So if you have no brain, you have no pain. So
okay.
So one area that the brain is sent to is the prefrontal cortex. So that's at the front of the brain. I'll show you my brain here, not quite my brain, but it's at the very front of the brain. And that's where we can tell, as I said, those sensory aspects of pain, the intensity, the location, the type of quality of pain as well. But the pain is also sent to deep brain structures within, so it's basically inside in our ears, these structures that are almond shaped called the amygdala. And that's where we process the emotion of pain. So that's where this encoding this unpleasant quality of pain is actually processed. So that accounts for the sensory and emotional aspects of pain and the perception of pain. But then our body is very smart, and it actually goes about to activate a dampening system that can just dampen the incoming pain signal so that we're not completely overwhelmed with our pains. So this starts off again in the prefrontal cortex, and it descends. So the nerve fibers now go down from the brain down to the spinal cord, down through the brainstem, and it actually works to block pain coming in at the level of the spinal cord. And this is what a lot of painkillers do, like morphine or like some local anesthetics. They work to stop pain actually even getting towards the brain. So essentially, this is a very powerful response, and it's mediated by the body's own pain-killing neurotransmitters, such as endorphins, which people might know from the runner's high that you get. These are our morphine-like chemicals. Also, our endocannabinoids, which are the body's own marijuana-like chemicals that we all have. And neurotransmitters like serotonin and noradrenaline. And these are neurotransmitters that drugs like antidepressants work to increase. So again, this kind of highlights the overlap between mood and emotion and pain, and that's why pain and stress are so intricately linked. Yeah, so it's really interesting, but it's not also not that simple, because pain is so subjective and multidimensional. So me and you will have a completely different pain experience depending on, for example, your early life history. So we know that babies that are born preterm and have had to have some stressful and painful experiences in early life have permanently altered pain thresholds and pain perception. Early life stress, or even stress in adulthood, can make pain worse, depending on your genetics, depending on our sex and gender. So males and females actually do have different pain thresholds, and also to do with our culture. So in Western cultures, boys are told not to cry, so that can actually result in men actually suppressing their outward expression of pain. So that's why pain is so personal and so subjective. And we also know that with chronic stress or disease or trauma or inflammation, that the body's own pain control systems can become worn out. And this is when we have something that's called chronic pain. Chronic pain is pain, it's defined as pain that lasts for more than 3 months, but it often lasts for up to 7 years. So it has significant social and emotional and physical consequences on individuals. It can be associated with a disease such as osteoarthritis or fibromyalgia, but it can also happen in the absence of any injury at all. So some people might have, it might have been because an injury did happen, the injury healed, but the pain persisted. And we are doing research to try and figure out why this happens. We do believe that it's changes within the spinal cord and brain, and changes in the immune system that actually result in this increased pain signal being sent to the brain, resulting in chronic pain. So that's what we're trying to do, is try to understand what actually causes pain, what are the mechanisms, and find better ways to treat it and manage it and hopefully prevent it as well.
Okay, that is a lot of talk about pain and suffering. So one of the reasons we're here today is to also talk about some of the good news. And I know a lot of people at ATB really love yoga and meditation. So taking all that you just shared with us about the neuroscience and the body and the brain and pain, how does this all sort of connect to yoga and meditation?
Okay, so a lot of people might have heard of the fight or flight response. This is when our sympathetic nervous system is activated, and it is activated in response to pain or stressful stimuli. But we do have a balancing system called the parasympathetic nervous system, and this is great. It cools the fires of stress and pain. It's our body's own relaxation response, and it's active. We call it rest and digest. So it's active when you're fed and you're full and you're content and happy and relaxed. And this is when healing occurs. When we're stressed out, we might hold our breath or breathe shallow and faster. So one of the ways you can actually activate the parasympathetic nervous system is through breathing exercises, and particularly a longer exhale compared to your inhales. And yoga and meditation, one of their core tenets of both of them is breathing exercises. So yoga and meditation, they're both millennia years old. Their yoga in particular is not just flexing and poses, it's a holistic practice of the exercises, the breathing techniques, and deep relaxation exercises. And also there's a meditation or mindfulness component to yoga. So we do know that yoga can make us feel better, but why is that? there is a lot of increasing evidence that yoga and meditation actually change your brain, and they change how we deal with stress, and they reduce inflammation in the body. So in addition to like physical benefits of yoga, such as flexibility, which everybody knows, and better posture and better balance and better sleep, we also know that yoga can reduce inflammation in the body. And there's also mental benefits as well, so relaxation and stress management and better control of our emotions. But as I said, you do not have to be flexible. So there's a lot of myths surrounding yoga. You don't have to be flexible to do yoga. I could not touch my toes when I started as a 20-something-year-old grad student. I can now touch my toes, but I am by no means flexible at all. There's a lot of men who are actually getting into yoga now, and even like the NFL are having their teams doing yoga, which is really good. There's so many different varieties as well. You can have an athletic practice, such as Ashtanga, or a really relaxing restorative class. Yoga can be done during pregnancy, and there's a lot of evidence as well coming out, studies that show that yoga in school-going children and teenagers, it improves their concentration, improves their performance at school, and it reduces their stress.
Wow. Okay, so we just need meditation and yoga for everyone at ATV.
Yeah. So there's lots of different types of meditation also, but the one that was kind of more popular in the Western society is mindfulness meditation, and this is essentially just concentrating, but you're not clearing your mind. Again, it's not about that. It's about bringing into the present moment, and lots of studies show that this activates the parasympathetic nervous system, but more importantly, it shows that we can change our actual brains. So it's like working out your brain. This is from a process called neuroplasticity. It was once thought that you were born with the number of brain cells you have, and then that's it, they die off over time. But we now know that the brain can change itself and can learn new things. So basically, doing a meditation is working out your brain, which I think we all really need to do.
I love that. And yeah, we'll talk a bit about, I just started my brain workouts. So the series of videos we're doing is called Rejuvenation and Resilience. And it's just so interesting to bring all of your research into this conversation. Let's try to connect using yoga and meditation to both reduce pain and stress, but also to increase our resilience. What do you think about that?
Sure. So there's some really, really good studies that have been done, particularly with yoga. In people who've never done it before, and they've done maybe an 8-week class of 1 hour of yoga per day, and they've put them into the brain scanner, and they've looked at their brains and the changes over that short 2-month period. So both an 8-week course of both yoga and meditation has been shown to reduce stress. That was correlated with reduced size of the amygdala. So the amygdala is the alarm system that's responsible for all your stress, fear, and anxiety. So if you can reduce this, you can have better control over your emotions and lowered stress. So we can see that with even in such a short time. There's also a really important area in the brain for learning and memory, and it's one of the main brain regions that's affected by Alzheimer's disease. So this really cool study that did yoga in elderly patients showed that they had increased grey matter in their hippocampus, which was associated with improved memory. So that's really important for our resilience through aging. And with regards to pain, there was a study that looked at regular yoga practitioners, and they tested their pain thresholds and tolerance, and they showed that the people who did yoga had twice as much pain tolerance compared to the people who didn't. So I think that's really fascinating, because that is, a lot of analgesic drugs that we would take that would do something like that would also have a lot of side effects. So it was pretty cool. And that was also correlated with the changes in the insular cortex. That is an area that we know that is involved in the intensity of pain. So it's just really cool to see all of these changes and effects that have been known for years, but show that there is actually a neurobiological reason behind what we're seeing.
And that's why we get experts like you to come and explain all of this to us. Okay, so let's chat a little bit more about you. I mean, this is your career, your passion, your academic life. But what about your personal life, your health and wellness? Do you practice yoga, Nikita?
Yeah, so I practice yoga and meditation as an antidote to my studies on pain and stress every day. So that's where my interest comes in. I've been doing it for about 6 years now, and I actually started off. I did a, a, a course with my mother when I was about 12, and I really enjoyed it, but it didn't stick. So then, when I was a very stressed out grad student who had a lot of pain from working long days at the computer and doing experiments, I started yoga, and I'm not exaggerating when I say it changed my life. So it helped me to be much calmer. It helped me to reduce my own pain levels. And it is, as I said, just the perfect antidote to a stressful lifetime. Um, I tried to do meditation, I've really found out that going to a group class helped me a lot to do that. So I do try and do at least 5 minutes of mindfulness meditation every day. And I think it really, really helps to just take a few minutes to yourself and decompress a little bit.
Well, I'm very new to my own meditation practice after years of promising that I would start. And like a few other people I know around ATB, I purchased a Muse headband, a MUSE, Muse headband. So it's a biofeedback piece of technology that lets you know how calm or not calm your brain activity is. And let's just say I've had varied results so far, but all that does is motivate me to stick with it. And it is very simple. I have now the app and the tool and the technology to let me know how I'm doing and encourage me to keep going. And I found that, in my family, that's been the one thing that kind of just pushed us over into actually getting started.
That's great.
Well, we'll stay tuned, see how it goes. I know, too, you wanted to share a little bit with us about a body scan. So we talked about yoga and meditation, but what is a body scan?
Yeah, so I guess to put it into context, like one of the reasons I like yoga is because I find it, sometimes it's difficult to switch off the brain when you've been studying or working all day and there's things going on. So something that's a physical moving meditation, I find a little bit easier to get into. And the body scan is something very similar. So our parasympathetic nervous system that I mentioned is involved in monitoring our internal body sensations. So if we can just get out of our heads and get into our body, we can often notice that there's a lot of maybe emotions that are building up, like anxiety in the chest or fear in the stomach or, tension in the head. And if you can just take a few minutes every day or before you go to bed to just sit in your chair and bring your attention inwards and notice what body sensations are there, but without any judgment. So, don't say, oh, my shoulder is sore. It's always sore. Why does it have to be like this? Just feel the pain and acknowledge it. And you can actually do some deep breathing exercises. And oftentimes you'll find that it actually will kind of disappear for a little bit. And one thing you can do is just scan through your body, essentially, from your head down to your toes, and notice where there's areas of tension. So I carry my tension all in my shoulders. So I need to check in every day, like multiple times every day, just to relax. Also in the jaw and the face. And in the stomach, a lot of people carry tension there. So the body scan you can do 1 minute, 2 minutes, or 20 minutes. And I think it's a really, really effective exercise. And again, the same with our yoga and meditation. They've put people who do body scans regularly into the brain scanner, and they've showed that it does increase brain activation in the prefrontal cortex, which is an area involved in attention and reducing mind wandering. So practicing something like a body scan is very, very easy and very simple for any person to do.
Okay, and so as we start to wrap, what would you say is your best personal and professional advice for our team members to increase their resilience?
I would say to do a regular practice. Personally, I do yoga and meditation in the morning before I go anywhere. And even if it's just 15 minutes, it can be so, so beneficial. So neuroscience is showing us that frequency rather than duration is more important. So if you do a regular practice in little bursts rather than maybe like an hour or 2 hours during the week, Also, neuroscience shows us that multitasking does not work, and it just deflects all of our faculties and attention. So whatever you're doing, do it and do one thing at a time and focus on it and be mindful while you're doing it, and you will do it better and you will feel less stressed and more resilient as well. So essentially the main thing to do with these yoga meditation practices to increase our resilience is that you're doing it to, as I say, weave your parachute so that you have a backup in times of stress so that you're buffered and protected. So that's essentially, yeah, that's it.
I love the visual, the parachute for when you need it. That's great. And I know, Nikita, you're going to share some slides, some content, and some resources that you've pulled together for us. So we'll post that along with the video link, which will be very helpful, especially if people want to take a deeper dive into all the things we've been chatting about today.
Yeah, especially this book, which I would highly recommend. It's called The Buddha's Brain, and it's written by two long-term meditators in collaboration with some neuroscientists as well. So it gives some practical tips and also like the evidence of what actually meditation is doing to our brain. So I would really recommend that book.
Perfect. Okay, well, Nikita, thank you so much for the great conversation, for sharing both your research and your personal practices. It's been amazing to hear how you have both perspectives, that you're doing the research and then you're also practicing the results of your research.
Thank you so much for having me on. I really appreciate it.
Okay, well, and for those of you watching, stay tuned for our 8th and last part of our Rejuvenation and Resilience video series coming soon. And remember all the things we learned today from Nikita, including the neurons that fire together, wire together. So hopefully that's all of us as we continue on our journey towards better resilience. Bye for now, and thanks again.
Bye.